Hi, my name is Jill Castle. I'm from England in the UK. Thank you very much for letting me share my story with you all today at the very first International Birth Test Summit. Thank you very much to Laura Fry for organising this. She's an absolute legend. So just a little bit of background about me. I am 41. I'm a retired police officer. I have one child called Sam and I'm married to Chris. When I gave birth to Sam, I was 32, so that was back in October 2011. Now, Sam was actually born 6 weeks early when I was 34 weeks pregnant. So I went into spontaneous labour. I'd had a very easy pregnancy, very fit, healthy, active young woman, did a lot of walking. I was a police officer. I was very engaged with my work, absolutely loved my job. I've always been fit and active. I used to be captain of the hockey team. I was on the netball team. Used to do a lot of swimming. You know, physical activity was a massive part of my life. And I was always one of these people that was never ill, never had time off school, never really had anything wrong with me. So there was no reason to suspect that I would have a difficult labour. Anyway, when Sam was born, like I say, he was 6 weeks early, and the labour itself was fine, as labour can go. It was pretty painful, as all labours are. But his heart rate dropped quite dramatically, so they had to move very, very swiftly to get him out. So I was wheeled along to the operating theatre, where after 3 attempts they managed to give me my epidural and whipped poor Sam out using Neville Barnes forceps, which did crush his face a little bit but didn't leave him with any long-term damage. He was sent off to the special care ward, where he was checked over because he was grunting because of course his lungs hadn't fully developed when he was born because he was so premature, even though they had given me the steroid injection during labour. When he was taken off to the special care ward, I was stitched up and I was told, you have suffered a 3rd-degree tear, which is quite a bad tear, but you'll be fine. You know, we've stitched you up, off you go back to the ward and you'll just get on with your life, basically. I was told, you know, you must keep the area clean, you must have a shower and then dry it properly. Basically, you need to try and stop infection. I was like, all right, that's absolutely fine. That sounds like something I can do. I had no reason, again, to suspect that it was going to get any worse, but I was amazed by how much pain I was in. I couldn't believe how uncomfortable it was to sit down, to move, to get off the bed, to go to the toilet, to walk. And I remember being on the early baby ward and Chris, my husband, and I looking around the ward, and we saw all these women clutching onto the walls, hardly able to walk, in a lot of pain. And my husband said, you know, Jill, this reminds me more of a field hospital, not a 21st century birthing ward. You know, we could not believe how many badly injured women there were as a result of giving birth, because you only normally see women walking about with their babies and their prams and their pushchairs. You don't see them staggering about, hardly able to walk. Anyway, like I say, I was very, very uncomfortable as a result of the tear. I didn't really know actually what a 3rd-degree tear was, but I just knew it was bad. I knew that a 4th-degree tear was really bad, a 3rd-degree tear was pretty bad, and a 2nd and a 1st weren't as bad, and that's all I knew. I made very sure that I kept the area clean, but the very next day after I'd had the baby, after I'd had Sam, I noticed sort of a brownish discharge on my underwear. And I thought, well, that's a bit strange. So I mentioned it to the midwife and she said, oh, that's fine. That's just, that's just from the tear repairing. And I thought, right, okay, I suppose, because, if you scrape your knee before it scabs, it gets right a little bit brown, a little bit mucousy. So I thought, well, maybe that's what that's from. But the area around the tear was getting so painful. It was getting more and more and more painful. And I kept mentioning this to the midwives. And I kept saying, but it's getting more painful. Why is it getting worse? I don't understand why it's getting more tender. Every time I try and move, I'm like, I was really jerking off the bed. They kept examining me and saying, no, this is fine. And, the words that they kept repeating all the time was, the heat around the tear and the pain around the tear is just from all of the tissues knitting back together. And I kept thinking, right, okay, well, I suppose that would create heat. But at the same time, I was thinking, but normally, when you're recovering from things, you start to feel better, but I started to feel worse and worse. And then every time I went to the toilet, I was in so much pain, I ended up starting to pull the emergency buzzer. And people came and helped me when I was in distress on the toilet, because I was in so much pain, especially when I was having a poo. And I was getting really distressed and really frightened, because I started to fear going to the toilet, and I started to fear what was wrong with my body, because I knew that there wasn't something right, and everyone just kept saying the same thing to me all the time. This is normal, this is normal. So I remember then having a shower and seeing poo coming down my legs. Not a great deal, but I remember thinking, well, I don't know where that's coming from. And I couldn't understand where this was coming from. So again, I called the emergency buzzer, and I was in a lot of pain. I was crying. I was really, really distressed. And I remember saying to the nurse, this is so undignified, but this is just what you go through. I remember bending over, having my backside up, basically, and saying, can you show me where my anus is? I don't know where it is. I don't know what's happened to my body. I can't understand where the poo is coming from, but it's not coming from the right place. She looked at me like I was completely insane and just said, it's all right, love, it's in the right place. You just have a shower and tidy yourself up and you'll be all right. So again, because I was dismissed, I thought, yeah, well, okay, I'm going crazy then. And, when I look back, I think, if there's a woman in so much distress having a shower and telling you that they don't know what's happening to their body and that they don't even know where their anus is, surely that's a bit of a warning sign that something's going wrong here. Anyway, on that continued for another couple of days. The pain was getting basically unmanageable, and I was trying to walk along the corridor, holding onto the wall. Bearing in mind, I look pretty fit and healthy now. That's how I looked at the time, but I was unable to walk by this point. And I was met in the corridor by a male midwife, and he, sort of tried to help me up off the floor. And I said to him through tears, I can't do this anymore. I can't do this anymore. I'm in so much pain. And he said the infamous words to me, which were, maybe it's your perception of the pain. And something in me died actually at that point. And I thought, right, he doesn't believe me. Nobody's believed me. Nobody's listening to me. I'm obviously going completely mad, and people think I'm a complete wimp. He offered to examine me, but I refused. And word must have got back to the consultant team, because then I was examined under gas and air. I was in so much pain they had to actually give me gas and air. It was discovered at that point that I had a missed 4th degree tear, a massive abscess all the way around my perineum, and I also had a recto vaginal fistula. All hell broke loose. I was told then that I would have to have a colostomy in order to divert faeces away from the fistula and away from the tear to give it a chance to heal. I was told that this would be temporary, so it was only going to be for 12 weeks, and then they would reverse the colostomy, stitch me up, and I would get on with the rest of my life. So this is 7 days after the birth I was given a stoma. Didn't really know what one was beforehand, to be honest, but I was really relieved to have it, because I would have done anything to get away from this pain. So then there I was, separated from my baby for a weekend. I went on the adult ward and had my stoma fitted. He had to go to the special care ward because he was tube fed, and I was fitted with a stoma, and he was looked after by specialist nurses. We were then reunited. Another week in hospital, sent home. Over the next year, I spent frequent time in and out of hospital getting my septic fistula tract treated and drained. I was almost permanently on metronidazole. I was diagnosed with post-traumatic stress, postnatal depression, severe anxiety. I was barely able to walk because of the fistula, and obviously I was actually struggling to cope with my stoma. I had a stoma that I was trying to manage. I had a premature, very small baby. My husband worked in oil at the time, so he was away from home for weeks at a time, and my family were 150 miles away from me, and it was horrific. After 7 months, I eventually moved 150 miles back home. I was in the process of being medically discharged from my job as a police officer because they decided that my emotional and physical problems were too much for me to continue in my job. So all of this was going on just as a result of me giving birth to a baby. I was invited to the hospital and I spoke to the consultant who delivered Sam, and she apologised. She said this should never have happened to you. And I do actually stand by what I said to her, which was, I don't blame you. I'm grateful to you because you delivered my baby safely, and if you hadn't have done, he would have died, which is a fact. And she is a human being, and she made a mistake by missing my tear. She initially thought it was a 2nd-degree tear, stitched me up, then thought, no, this is a 3rd-degree tear, so took the stitches down, stitched me back up again, and sent me on my way. She'd actually missed the fact that it was a 4th-degree tear at all. And because the tissue around the tear was so friable by this point, there's no way that it could be repaired. So yes, it was her mistake, and it was also identified in the hospital report that was carried out subsequently that she didn't call for help from the colorectal department like she should have done. Maybe she was too proud, I don't know, but maybe there isn't enough communication between the obstetricians and the colorectal team. I don't know, maybe that's something that should be looked into, but she battled on herself to do it herself, and in doing so damaged me for the rest of my life. But she made a mistake, and I don't feel bitter about that, really. I just think that's just one of life's things that happens. So here I am. I'm now 41, permanent stoma, medically discharged from the police. And how am I getting on? Well, actually, my story is a positive one. It took me many, many years. I had counselling. I'm still on citalopram. I'm still on anti-anxiety medication, but I don't drink alcohol. I started exercising about 3 years after the baby was born, just by walking. Then I joined a triathlon club. I did a half Ironman triathlon. I've subsequently gone scuba diving, parachuting. I do open water swimming. I am going to be, hopefully, the first ostomate to swim the English Channel solo in 2023. And I have turned my life around. I actually feel quite empowered by everything that I went through. I look back at all of the hell that I went through, the trauma that I went through, the emotional distress and the physical problems that I had that I've somehow managed to overcome with time and by being kind to myself and with the support of my family. And that has made me feel powerful. And it has made me realise how incredibly resilient people are, how resilient women are. And I think that there needs to be more focus given on this to women who have suffered severe tears. They need to know that there is hope, that you can suffer these catastrophic injuries, but, life can turn out okay. You can recover from this. You can enjoy life again. Your life will be different from what you expected, but you can do this. And I want my message to be one of hope to all women that suffer these horrific tears, that you must have hope that you can come out of this happy and healthy like me. So thank you for letting me share my message with all those women out there. Thank you.